mounting concerns over this video that appears to show Carrie Jones in active labor at Dallas Regional Medical Center in Mesquite, Texas, last week.
Y'all treat all your patients like this or just the black ones?
Jones's mother posting the video on social media.
I said, can we get her into labor and delivery? She said, no, we have to fill out all this paperwork.
The family alleges hospital staff delayed Jones's care for more than half an hour. In a statement to NBC News, the medical center says in part that we are committed to providing compassionate, high-quality care to every person who comes through our doors, and we are reviewing this situation to understand what occurred. In the U.S., black women report facing disproportionate levels of unfair treatment in healthcare settings and are 3 times more likely to die from a pregnancy-related cause than white women. In Crown Point, Indiana, another alarming video. Mercedes Wells says she sought care from Franciscan Health.
I'm going to go into this, but I'm going to give you a couple of things to remember. One, we have a hospice in Crown Point, Indiana, so I know exactly what goes on in Crown Point, Indiana. But when they're talking about black women are more likely to die from childbirth than other women, that part of it is true, 100% true. And it goes back way beyond what we look at today. Back in the day, how they viewed us and their thoughts on how we view pain and how our pain thresholds were different. A lot of people still have that same ideology. I do believe we're about a half a generation away from finding out what that's going to look like and people really believing a certain thing. The other part of this, though, the new bill that they're bringing out that says if you come to the hospital and you want to be discharged, they now got to give you a plan. I don't know why it takes social media and 50 million people saying that you should not kick someone out of the hospital while they're in childbirth for someone else in a room to decide that we should not do this. However, what it does tell me is that we have to continue to share our stories. We have to get more people to talk about these stories. And lastly, and this to me is probably the most important part of all of this. If you've never done it before, whether it's your mom, your grandma, your aunt, stop going to doctor's offices, stop going to hospitals, and you have your phone, you can record that information. Because what's gonna happen is these stories that we have are just stories that we have because a couple people recorded it and those stories got out. I would argue this happens thousands of times and no one ever finds out about it. What we have to do is document and hold people accountable for things that they're doing, particularly when it comes to racism and also classism. Let me know your thoughts in the comments.